What's going on, everybody? Welcome to the show. My name is Tim Poole.
And I'm Adam Krigler.
That's Adam.
Hello.
We're hanging out. We also got Lydia of White Run chilling.
Hello, hi.
Dude, the news is getting scary.
It is getting
Seriously
scary.
getting scary. There was a period where kind of felt like things were chilling out.
Yeah.
I was feeling better. Seemed like things might get back to normal. Trump's talking about getting things back up and going by Easter.
Yeah.
Stock market's rallying.
But now then what was it? The Surgeon General said, "Nah, it's gonna get real bad," and then someone posted something. I saw this. I don't know where I saw this. They said April 1st, TikTok.
What's going on with that?
Rent is due.
Oh.
No one pays rent.
Yeah, right.
Nobody's worked for the past week and a half, 2 weeks.
2 weeks.
Yeah,
Most
half a
people
month's
can't
rent.
handle a $400 bill.
Let alone 2 weeks of not working at all.
And right now, the funny story that everyone's talking about is that Cheesecake Factory is not going to pay its rent, and it's like it's not necessarily funny, haha. It's funny like people are laughing like, oh no, Cheesecake Factory, they're joining the socialist revolution or something. That's scary. It's a major food chain.
I honestly kind of expected them to die off already.
But
long ago.
Dude, they're
Like,
always packed. It's like a big mall restaurant.
I had no idea. The last time I was in there was with you, and
They were mean to us.
It was kind of. It was
They
a
were mean to you?
weekend.
It was packed.
But it was a weekend.
It's
so
not,
it kinda makes
it's not even
sense,
about
but, like,
whether we want to speculate as to the economic health of the
Okay.
Cheesecake Factory
The fact-
franchise.
of the matter remains, they're not
Dude,
paying their rent.
April 1st is days away. And many people have just skipped a paycheck or more.
Yeah.
And they're going to be like, I don't have it.
Yeah. What are they
I'm
going
not
to
going
do?
to pay it.
Oh,
Yeah,
they
what do
can't
you
get
do?
evicted right
Yeah.
now, right?
I mean, I don't know. But this is going to ripple, man, because check it out.
Yeah.
That means all of these landlords who are waiting for that money to come in to pay their bills,
Right.
boom, that's when it hits. It's
True.
going to ripple out like a gong slam. Boom.
Yeah.
Landlords, then they have no money, can't pay the maintenance people. Here we go.
Yeah. And that's just the first thing on the list.
Yeah, man.
Man, this is getting scary.
Yeah.
Well, before we get going, I don't know if you guys can see my shirt. Let me get the mic out of the way.
Hey,
Look.
check that out.
Check
Look
out
at
my
that
check out my
design.
nice shirt.
For those that are listening,
Anybody recognize this shirt?
Adam is wearing a shirt with my beanie on it.
I
Ooh,
am wearing his beanie on my shirt.
very cute.
This came in the mail today. We got it's the wrong colors, but it's pretty sweet.
It's okay.
It's
you know.
clearly a beanie.
This needs to be darker, but I
Yeah.
think it's great.
I love
You know what's
it.
funny? It actually matches my hat, my
does,
colored
and I
beanie.
like
It's a fusion.
It's a fusion of our beanies.
All right.
Anyway,
See,
yeah.
Even though the world is ending,
We're talking about
we all have a
beanies.
good laugh,
That's right.
Get your beanie shirt.
and then we have a nervous laugh because it's getting scary out there, man. But hey, before we get started with the first story, which is one of the scariest things I have
Oh my
ever
gosh.
heard,
Yeah, this
hospitals are basically saying,
This is crazy.
You die,
Yeah.
you die, and we're not going to save you. This is from the Washington Post. Hospitals consider universal do not resuscitate order for coronavirus patients. That basically means if you are brought to the hospital with coronavirus and you start going into it, they're going to be like,
Yep.
it's nice knowing you, buddy.
Oh, man.
I mean, they'll put you on the ventilator though, right? Is that the case?
I don't know.
Imagine.
Or is it after?
No, I don't know.
After that, and then it doesn't work, then it's like psh,
Maybe.
nothing else we can do.
Maybe.
I would think that they would draw the line at trying to resuscitate. Obviously, DNRs do not
Yeah.
resuscitate, so doing compressions and stuff.
Right.
Right.
That's
Oh,
like
I see.
emergency. Your heart.
They're
just
talking
stopped.
about all hands responses.
Right.
Oh, okay.
So you're on a
okay.
ventilator.
That's
You start
code.
spazzing out. They're going to be like, no,
Code blue.
There he
Just
goes.
kidding.
Nothing we can
he's
do.
out.
Boy, bye.
Dude, you know, I was reading some of these stories,
Oh,
and they
man.
said that there were people who were on ventilators, and you can see them slowly turning blue.
Really?
Oxygen in their lungs on maximum pressure
Yeah.
because the fluid buildup was so intense that even with pure oxygen, and they have the machine blowing air in and pulling out,
Yeah.
whoosh, at max, your lungs are always inflated.
There's no
You're not
room.
breathing. You're just knocked out with a tube down your throat.
Yeah.
And people are slowly turning blue because they were getting no oxygen. Dang. So they're basically like, you know what? We can't do anything about it.
I mean, how do you do anything about it other than like operating and taking out the fluid or scraping the sides of the lungs?
You
Right?
can't. You can't.
It's
no,
a
no.
fine
Can you
network.
even do that?
It's
No,
a-
because-
it's a fine network of really, really tiny little capillaries.
Little balloons.
Yeah. that's
And
where the oxygen comes in.
what I was reading is they said that when they fill with fluid, when they put people on the ventilators on max pressure,
Yeah.
it starts breaking up all the little, what are they called, like alveoli or something?
Yeah.
Whatever.
Alveoli.
They start bursting and then they become completely useless.
Oh.
People die.
So the ventilators are actually having a negative effect.
Well, you're dead without it, but it slowly rips your lungs apart.
Yeah.
Dude, people don't get it, man.
This is insane.
Listen. They're saying the hospitalization rate is 20%, right?
Okay.
Like, you realize that means if we don't have hospitals, the mortality rate's like 20%.
Yeah, that's true.
If somebody needs to be in a hospital because they're collapsing, it's not that's a bit of an exaggeration. It's not 20% because some people need to be in hospitals just for observation because they're getting bad.
Yeah.
But if if it's even 10% of people, because Governor Cuomo said 15%. New York has right now, according to Cuomo, 10,600 beds available, ICU beds.
Okay.
That means they can handle, based on their own numbers, 70,000 people in New York City getting sick. 8 million people live in New York City.
Yeah. Alone, just a city.
And this is spreading fast.
I thought it was 9 million.
It's probably,
last I checked.
I mean, look.
Pretty sure it's 9 million.
8.6 or something.
Yeah,
Okay.
but when you
Closer to
combine
9.
the suburbs, places like New Rochelle or
Yep.
like what else you got? You got Westchester? No. What's north of New York on the western of Manhattan? I don't know, whatever it's called.
Yonkers?
Yeah, there's Yonkers. There's also isn't Westchester? Is
I
that
would
up there?
imagine up there on the west.
I don't know. Whatever. The point is,
No.
it goes up to like 13 million. So that's why everyone's freaking out.
Yeah.
Because people don't realize the mortality rate's down because people are working overtime in hospitals.
Yeah.
So
Once
I don't know,
we
man.
reach maximum full capacity, basically, it's like then the deaths are just gonna really start
Yep.
going up.
yep.
Because right now we're like handling it as best we can with the load that we can take care of.
Yeah.
Man. It's,
Well, so we're at this point now. The Washington Post is reporting it, but guess what? This story that we're seeing about the Washington Post, it's been repeated by El País in Spain and in Italy. That they're getting to the point where it's in different forms, but it's basically deciding that you must die now.
yeah.
That I'm sorry, it's your time. And the scary thing is, this is the most extreme I've ever seen it, where they're saying universal DNR. So like in Italy and Spain, they're basically saying perhaps we just let the old people die
Maybe.
and prioritize
Yeah.
the young.
Yeah.
They're
Not even saying that.
right here. They're
There's
saying
nothing in there.
everybody
Anyone who reaches
and that's
that point.
and that's the other thing too. We
It's
got
over.
a bunch of stories here about young people who are dead. 21-year-old, 25-year-old, 22-year-old.
Is that a 17-year-old?
There was a 17-year-old. So
You were saying there was an infant,
There's a 2-month-old right now on life support, and there's a newborn in isolation.
and it's because they have coronavirus.
Mm-hmm.
And it's like they've been reporting, as far as I remember, that it doesn't affect kids.
yeah,
Doesn't hit
Those are-
kids. Doesn't hit kids at all.
no,
Yeah.
dude, the media is full of it. They're probably full of it right now. I had no idea what's going on.
I have no
Because
idea.
for
man.
from the end of January till the mid February, the media was going nuts saying, the flu's worse.
Yeah.
And now a bunch of people are saying that, and they're going, those dumb conspiracy theorists. Bro, they were reading your news outlet.
Right.
The Washington Post on, what was it, February 4th. Get a grip, America. The flu is way worse. Where are we at now? A month later. We will not try and save your life. I'm sorry. Thanks, Washington Post.
Yeah.
That's on you. You know, look, I was critical of the president for having having downplayed the response, but now the media is trying to act like they were right as well. No, everybody got this one wrong.
Yep.
Not everybody. Tucker was right. Tucker Carlson, Fox News was on this real early, February 3rd, I think. But there were a lot of people who were on this early, and it wasn't the media. They were the ones who were dancing around talking about how there's a meme going around. It's not really a meme, but it's this graphic of all of these different news articles. It's ridiculous, like 25, 30, maybe even like 40 news articles where it's like the flu is worse, ignore this, Trump is exaggerating, he's a bigot, and all this crazy stuff.
Yep.
Where they downplayed it. And this is where we get to be right now. So
This article is crazy.
yeah, man. Well, let's read. But real quick before we do, if you guys want to get in the super chat and have your questions answered by us, we will jump over and make sure you subscribe if you want to get more videos. But let's read from the Washington Post. They say hospitals on the front lines of the pandemic are engaged in a heated private debate over a calculation few have encountered in their lifetimes. How to weigh the, quote, save at all costs approach to resuscitating a dying patient against the real danger of exposing doctors and nurses to the contagion of coronavirus. The conversations are driven by the realization that the risk to staff amid dwindling stores of protective equipment, such as masks, gowns, and gloves, may be too great to justify the conventional response when a patient codes and their heart or breathing stops. Northwestern Memorial Hospital in Chicago has been discussing a universal do not resuscitate policy for infected patients, regardless of the wishes of the patient or their family members. A wrenching decision to prioritize the lives of the many over the one. I want you to imagine something right now. I want you to imagine that's you inside a hospital, and that's your mom on a breathing tube, and all of a sudden you start hearing beeping going off, and you start screaming, "Help her, please!" And the doctor holds you back and says, "No." Dude, the people who downplayed this stuff, the people who joked and laughed about it, the people who think it's not happening, it's like, I'll tell you what, man. When it finally comes to you, this is worse than, the grasshopper and the ant. The story where the grasshopper, the story?
Yeah.
I talked about this when it came to supplies. Like, when the store shelves get shredded, you're going to come knocking. This is way worse. It's going to be you on your knees begging, "Please save my mom, save my dad, save my friend, save my spouse," whatever.
Yeah.
Yeah.
And it's not, and we could have seen this coming. Check this out. In Italy, the extraordinary decision facing Italian doctors: there are now simply too many patients for each one of them to receive adequate care. A lot of people think it's not happening.
Yeah, they've reached critical mass over there in Italy. So now it's like getting to that point.
And that was 2 weeks
That was a
ago.
while ago.
That was
yeah.
2 weeks ago.
So they're saying now that
So
Italy's
for
getting
the past 2 weeks, they've
Yeah.
had to make these choices.
Yep. So check it out. I'm seeing a lot of people say things like, "I don't know anybody who has this."
Right.
Well,
Good for you.
So
yeah,
what does that mean?
right.
That's some
I'm
selfish
like-
attitude right there.
Yeah.
It's like, dude, have you watched any of these videos?
Right?
Man, it's there was a 22-year-old kid. There's let me just show you some stuff, man. And then I want to come back to this though.
Oh yeah.
21-year-old woman with no underlying health conditions dies of coronavirus. What do people think, that like all of these different governments and people who hate each other are working on the secret plot? Like Trump and the Democrats are working together to trick people? Like, that's ridiculous, man.
Do you think she was a smoker?
I don't know.
Because I hear that if you're a smoker, it's significantly worse.
It does make it more likely. yeah,
So,
it's true.
I mean, I'm hearing all these younger people are dying, and it's like, were they smokers? Because, I mean, I used to be a smoker, and I quit smoking 6 years ago. So it's been a long time since I've had a cigarette, but I hear it's really bad for your lungs in general.
Totally.
So, let alone a lung disease.
Yeah, I heard if you have
that's
a history
attacking
of
your lungs.
smoking,
Listen.
it's the same.
We just watched some videos before we went live, and I can't confirm them, so that's why I'm not going to pull them up. But I believe they're more likely than not real, of things going down in China to this day. China's lying, man.
Definitely.
There's a video going viral of like a bunch of different clips of China having like the entire highway is full of like 12 major trucks spraying disinfectant.
Yeah, out of these huge, like,
There's-
cannon-looking things.
Yeah.
There's people. There's
crazy.
like one clip is a person just like laying on a bench, and a couple guys in hazmat suits come and just like start taking the bodies. There's videos where someone's driving on the street and there's just bodies on the sidewalk everywhere. I kind of feel like it's crazy because right now it feels like the media, especially Trump, they're desperately trying to keep the morale up.
Yeah.
Trump is saying we're going to get back, the economy is going to kick back into gear on Easter. He's like, that's my goal right now. He's like, we'll confer with the health experts and we'll see what's going on. Dr. Fauci said we'll be flexible. I think Trump is doing that because he wants to give people some certainty right now.
Yeah.
So that, there's going to be a lot of people who think, okay, I'm going to invest in the market. Let's get the economy working again because it sounds like we may have an opportunity to make some money here if we get going in Easter.
Yeah.
I'm willing to bet once we get to Easter, the doctors and Trump are going to say, we're really close. We did an assessment. We think we need one more week. And then a week's going to go by and they're going to say, everything's going great. The market's going to be rallying now because we have some certainty.
One more week.
One more week.
Yeah.
One more week.
Yeah.
One
3
more.
months later.
Or something happens, and I think here's the big challenge. Hospitals need money. Hospitals need resources, and we can't. If the economy collapses,
Yeah.
people die.
And the hospitals are only going to be able to run for so long.
Yep. And what happens when healthcare workers on the front line start deserting?
Or the electric companies, like their employees can't make it back to work
Yep.
because some of them are dying and
then we're already hearing
the
stuff.
electricity goes out. Then
fix
people
it?
are really screwed.
Man, it feels like we are dangerously close to the precipice
It's
on this
really
one.
getting scarier and scarier every.
But here's the
day,
thing, man. The past week, it kind of felt like things were getting back to normal almost. Not entirely, but it felt like it got really scary and then started to get a little less scary. Like the store had milk again.
Well, it
you
looks
know?
like the graph, because if you look at the graph from China, it goes up and then it kind of teeters off for a while and then spikes again.
Yeah.
It feels like we were in that little stage where we're like, wait, is it under control? Is it what's going on? And then now it's like, oh wow, it's way worse than we thought.
It actually gets a little bit scarier. So take a look at this story. Spanish doctors prepare to make difficult decisions if intensive care units reach capacity. Officials admit the worst is yet to come as Spain exceeds 1,000 deaths and field hospitals start going up across the country. This is from the 20th. Now over back at the original story, it's not just about this one hospital's universal DNR. It's that other hospitals across the country have started deciding to prioritize who lives and who dies. It's no longer that if you're in the hospital, we'll try and save you. Now it's like, look, man, we only got so many beds.
Yeah.
Here, let's read a little bit more. Officials at George Washington University Hospital in the district say they had similar conversations, but for now will continue to resuscitate COVID-19 patients using modified procedures, such as putting plastic sheeting over the patient to create a barrier. The University of Washington Medical Center in Seattle, one of the country's major hotspots for infections, is dealing with the problem by severely limiting the number of responders to a contagious patient in cardiac or respiratory arrest. Several large hospital systems, Atrium Health in the Carolinas, Geisinger in Pennsylvania, and regional Kaiser Permanente networks are looking at guidelines that would allow doctors to override the wishes of the coronavirus patient or family members on a case-by-case basis due to the risk to doctors and nurses or a shortage of protective equipment, say ethicists and doctors involved in those conversations. But they would stop short of imposing a do not resuscitate order on every coronavirus patient. The companies declined to comment. I want you to think about what that means. They stopped short of imposing it on every patient.
Oh, how nice.
That means they're literally going to be deciding, you know what, we are not going to save that person.
Yeah.
So now I want you to imagine that scenario set again. You're in the hospital, it's your mom, and she's got a ventilator, and all of a sudden, beeping, panic. Across the room is a guy beeping in panic. And the doctors run in, and there's a doctor in the hallway, and he says, not her, him. And you say, what about my mom? And he says, we will not save her. No. Back up. And then a cop comes in and drags you out, and you watch your mom die as they drag you away. Maybe it's a little extreme.
Yeah, it's a little
But these
extreme.
conversations scare
A
me.
little bit, yeah. I don't want to get to that point.
I have a
you
vivid
know?
imagination.
I mean,
Yeah, a little bit.
Now, if you will, the doctor gets coronavirus because he's trying to
Right, that's
save
what
the
they're
mom,
afraid of.
and then the entire staff gets it,
Right.
Yep.
and then all of a sudden there's no more staff.
Or actually something
You know.
I think is worse. It's, I've read these stories about doctors who have gotten sick.
Okay.
And a couple have lost their lives. In North Jersey, there was this guy, he was like, his whole life, he was like in his late 70s, and he contracted it trying to save people and died. And to me, that's like, it's a very honorable way to go,
Okay.
It's sad to hear it. But what's scary to me is the dishonorable way to go. When doctors start saying, I'm not getting this, man, I've seen what it does, and they bail out. Nurses start saying, for what? For why? Watching people die every day, getting paid nothing, working 14-hour days, and your family's without toilet paper? I know that sounds like kind of funny, but I mean, like, your family has lack of resources. You can't pay your rent. You're not making nearly enough. And you're like, I have to go.
Yeah.
We need to get out of the city. This is unsustainable. Then it all breaks. The dam breaks. Thanks for checking out this clip from the Timcast IRL podcast. We do the show live Monday through Friday at 8 p.m. If you want to catch the full show, tune in to this channel, subscribe, hit the like button, or check us out on iTunes and Spotify, and we will soon have this podcast up for free on all podcast platforms. Thanks for hanging out, and we'll see you all in the next episode.